Thank you for tuning in to learn more about the Community Health Assessment and Community Health Improvement Plan process in Greendale. We do the Community Health Assessment and the Community Health Improvement Plan every 5 years because it is required in the Wisconsin Administrative Code, DHS Chapter 140. The purpose of this process is to assess the community's health and then make a plan to improve it every 5 years. The Community Health Improvement Plan process is informed by the Community Health Assessment, and the Community Health Improvement Plan, or CHIP, is a series of work groups that are led by community volunteers and work to improve various aspects of health of people in Greendale. Currently, we have Successful Aging in Greendale for Everyone, or SAGE, Step Up to Better Health, the Community Alliance, and the Food and Nutrition Work Group. So 2020 marks a new CHIP cycle for Greendale, and I'm going to start by going over some of the findings in our community health assessment, which is an overview of data of various health factors for people living in Greendale over the last 5 years. First of all, our demographics. In 2019, the population in Greendale was a little over 14,000 people, and that has been slightly declining over the past few years. We are just over half female, 58% of people are married. The median age is 44, which is a bit higher than the state and the national average. And the age distribution is 23% of residents are under 18, 54% are 18 to 64, and 23% are 65 or older. Household makeup is 66% families, 9% of people are veterans, 6% of people were born outside of the US, and 7% of those 5 years or older speak a non-English language at home. For our race and ethnicity, 87% of the village residents are white, 6% are Hispanic or Latino ethnicity, 4% Asian, 2% Black or African American, and 2% American Indian or Alaska Native. In the last 10 years, Greendale has diversified by 10%. And when you look at the younger generation, our school district, it is even more diverse. For social factors, median household income in Greendale is $71,000, which is higher than the city of Milwaukee, the county, and the state of Wisconsin. Unemployment is pretty low at 4%. We have very high education level. 96% of people have graduated high school and 42% have their bachelor's degree. We have seen positive improvements in poverty over the last few years here. Overall, poverty decreased from 9% to 5% in the 2009 to 2013 American Community Survey to the 2014 to 2018. Childhood poverty also decreased greatly from 12 to 3%. Senior poverty decreased by 2/3, and however, at the same time, free and reduced lunch eligibility increased from 10 to 30% of students in the district. So free and reduced lunch eligibility is based off of income, and while it is higher than just the strict poverty line, it is showing that a higher proportion of families are struggling with income. For housing and environment, 67% of homes are owner-occupied. However, among renters, about half spend more than 30% of their income just on rent, which is considered a cost burden. And lack of affordable housing was identified as an issue in a 2017 and 18 focus group. For the environment, lead poisoning cases decreased while lead testing increased from 2017 to 2019, which is positive. Radon levels in homes tested have decreased, and the number of homes tested have slightly increased. However, the average level of radon does remain a little above a healthy level. Air quality is improved, but is still not at the good level. For health across the lifespan, birth outcomes from 2015 to 2019, we saw women who smoked during pregnancy decrease 12%. The teen birth rate remained very low. Low birth weight babies increased 3%. However, babies that were born to a mother over the age of 35 also increased 3%, which may account for that. And women who had graduated college before giving birth increased 14%. For death, the life expectancy in Greendale is 79 years. Leading causes of death are heart disease, followed by cancer, dementia, and accidents. And dementia as a third cause of death has accounted for an increasing proportion since 2017, as well as a higher ranking cause of death than the state. For communicable or contagious diseases, COVID-19 has emerged as a new communicable disease in 2020. However, over the last 5 years, chlamydia have been the top 2 infectious diseases, and sexually transmitted diseases led by chlamydia have been on the rise since 2015, as well as animal bites, which can spread disease, have also risen slightly. For chronic disease, diabetes, high blood pressure, and heart conditions do continue to affect health of village residents, and Greendale zip code 53129 has had more hospitalizations due to heart failure than 75% of the zip codes in Wisconsin. For healthcare access and quality, youth suicide attempts and serious considerations have increased, which we are expecting to be impacted by the pandemic. Cigarette use has decreased, but vaping increased. Marijuana use has decreased, but recently jumped, and misuse of prescription pain medication decreased. Fruit and vegetable intake among adults increased. 50% of people were meeting the recommended physical activity guidelines in 2018. Cigarette smoking has decreased, but binge drinking has increased, and 35% of people in Green classified as obese, which predisposes them to a variety of health risks. For health access and health insurance coverage has rose 5%. Cancer screenings have increased. Unmet medical and dental care needs have decreased. And health insurance coverage, however, was identified as a health concern among members of the Muslim community in a focus group, and navigating healthcare was an identified concern among seniors in a focus group. So that is a very quick overview of our community health assessment in 2020. But in order to move into the community health improvement plan, we want to hear your input, what you see as the most pressing health needs in our village. And we'll take responses to this survey very seriously for how we plan for the next 5 years. If you have questions about this data or questions about the CHIP process, or if you're looking to get involved, feel free to reach out to us on our social media, our website, or by calling the health department.